parturition by making a large incision on the abdomen. Definition. The name Cesarean is probably derived from Julius Caesar. It is also known the Latin word sedere, means to cut. The term section probably has its origin in the Latin verb secare/secco, meaning to light, strike, or reach, or to cut into, separate, divide, or part. Cesarean section in cattle. Indications. Inadequate cervical dilation, abnormal pelvic bone conformation, shape, in the cow, rupture of the cow's abdominal musculature, improper uterine position or function, abnormalities of the uterus or vagina, abnormal calf position that is uncorrectable in vagina, fetal monsters, presence of a dead fetus. Fetal oversize, fetal emphysema. Campbell and Fubini, 1990. Surgical approaches for cesarean section. Standing left paralumbar coleotomy, standing right paralumbar coleotomy, recumbent left paralumbar coleotomy, recumbent right paralumbar coleotomy, recumbent ventral midline coleotomy, recumbent ventral paramedian coleotomy, ventrolateral coleotomy, standing left oblique coleotomy. Selection of an approach should be based on the type of dystocia, the cow's condition, the environmental conditions, the availability of assistance, and surgeon's preference. Lauren et al., 2008. Standing left paralumbar coleotomy. The placement of the incision is indicated by the dashed line. Recumbent ventral midline coleotomy and recumbent ventral paramedian coleotomy. The proper positioning of the cow and incision site for the ventrolateral coleotomy. Standing left oblique coleotomy. Anesthesia. Generally, cesarean section in cattle is performed under the local infiltration anesthesia using 2% lignocaine hydrochloride. Local infiltration technique depends on the surgical site. Epidural block is also used depending upon the condition and the degree of straining. Judd, 2003. Anesthesia. 0.5 ml xylazine plus 2.5 ml lignocaine, 2%, via lower epidural route. C1-C2 for cows weighing 350 kg. Inverted L block with lignocaine. Inverted L block. Surgical technique. Preparation of the surgical set and washing of hand. Preparation of the site. Apply betadine iodine on the site. A large bold incision is made into the abdomen. Control the bleeding. Ligation. Follow a blunt dissection. Cut a facial layer, and 2 muscle layers. Reach to the peritoneum. Hold the peritoneum and make a stab incision. Let the peritoneal fluid to drain, and open it. Roberts, 1982. Kant. Try to reflect the omentum. Reach to the gravid uterus and exteriorate it. Palpate the fetal parts. Apply a sterilized drap on it. Make an incision on uterus, avoiding injury to a fetus. Hold fetal legs and gently remove it. Avoid intraperitoneal contamination. Hold the incised uterine edges. Remove the fetal membranes gently. If possible, remove the uterine fluid. Roberts, 1982. Wash it with the normal saline 3 times. Start suturing the uterus with Lambert followed by Cushing suturing technique in a double layer using number 1 catgut. Suture the peritoneum using number 1 catgut, by lock stitch or simple continuous method. Suture 2 muscle layers separately using number 2 catgut by lock stitch or simple continuous method. Apply some antibiotic powder in between 2 muscle layers. Suture skin layer with a cotton thread using horizontal mattress method. Kant. Roberts, 1982. Lambert and Cushing sutures. Sutures. Lambert sutures. Cushing sutures. Preparation of the site. Surgical site. Bold large incision is made on abdomen. Blunt dissection of the muscles. Approximation of the uterus and incision on it. Gentle traction of fetal legs. Gently remove the fetus, holding its limbs. Removal of the placenta avoiding bleeding. Muscle suturing. Care of newborn. Post-operative treatment and care. Give a broad-spectrum antibiotic, analgesic, anti-inflammatory drug, antihistaminic, oxytocin, 100 IU, glucose 5% I/V, hemostatics if necessary. Give laxative feeds. Daily dressing of a wound. Roberts, 2004.